Very warm welcome to the Joe webinar on Auscultation in Action, teaching cardiopulmonary dynamics. I'm Dr. Stephen John, a scientific outreach specialist, and I'll guide you through today's session. Joining me today is Dr. Lakshmi, who will be monitoring the chat box to ensure no questions are missed. Before we begin, let's cover some housekeeping items. You can use the chat and Q&A features to send in your questions anytime. Closed captions are also available for a more inclusive experience. So today's session focuses on innovative tools to teach and understand cardiopulmonary dynamics more effectively. This webinar is all about discussion and exchanging ideas, so don't hesitate to jump in. Right. So here's a quick overview of what we'll cover. First, we'll dive into the challenges educators face when teaching cardiopulmonary dynamics. Next, we'll shift our focus to the struggles students encounter while learning these complex topics. Following that, we'll introduce Joe's Solutions, a suite of innovative tools and content that support teaching complex topics. Finally, we'll wrap up with a live Q&A session. Before we begin, let's explore how Joe can truly be a game changer in understanding complex topics. As you can see, we are going to compare reading versus visualization. Let's look at this example. Consider the case of a 17-year-old patient with congenital transposition of the great arteries, CCTGA. Reading the detailed explanation gives important clinical insights, but the complexities of heart failure, say abnormal cardiac anatomy, and the process of total artificial heart implantation might remain abstract and difficult to visualize for many learners. So now imagine a video where you can visualize and also understand clearly. Let me play this video. I'll play glimpses of this video.
This video summarizes a modified procedure used to implant a total artificial heart in a patient with a history of congenitally corrected transposition of the great arteries, pulmonary atresia, and ventricular septal defect. In contrast to a normal heart, the anatomy of this patient's heart presented a challenge to TAH implantation, as it is characterized by L-looped ventricles, a morphologic left ventricle on the right side and vice versa, as well as transposed great arteries, with the aorta anterior and leftward to the pulmonary artery. In patients with normally structured hearts, the TAH replaces the ventricles in a crisscrossed arrangement. For the patient with transposed arteries and inverted ventricles, the surgical plan included modification of the TAH such that the right and left pumps were implanted in a parallel orientation. The TAH successfully bridged the patient to heart transplantation 5 months after receiving the device, demonstrating that with technical modification, TAH is feasible even in patients with structurally abnormal hearts.
The advantage of the total artificial.
All right, I'll stop it right there. Of course, you can watch this video. If you go to our website, www.joe.com, and go to the research section, or simply type in the title, you'll get this video, and it's open access. So the point here is you can see clearly what visualization can do. You can watch a video and understand how the malformed heart, the surgical modification and implantation process are clearly explained. And also it adds value by helping the understanding. So viewers could see how the abnormal rearrangement of ventricles and arteries required specific adjustments to the TAH, making the technical challenge clear. So that's how Joe comes in. Joe bridges the gap between words and comprehension by showing processes as they happen ensuring concepts like TAH implantation in patients with congenital heart disease are not just read but understood. With videos, the abstract becomes tangible and the complex becomes clear. Now let's dive into some of the teaching challenges. As an educator, when you teach cardiopulmonary dynamics, it comes with unique challenges. For example, abstract concepts like auscultation sounds and airflow mechanics can be difficult to describe verbally or with static diagrams. Engagement can be a hurdle when students can't visualize or connect the anatomy and functions in real time. That can be a problem. And retention of terms like bronchial breath sounds versus vesicular breath sounds often requires multiple repetitions without interactive methods. Joe addresses these issues by combining scientific accuracy with engaging visuals. Now let's understand some of the difficulties among students, specifically student struggles. From the student's perspective, here are some key struggles. Number one, time constraints. With packed schedules, it's really hard to dedicate extra time to grasp complex concepts. And also just with books and 2D diagrams, it's very difficult to replicate real dynamics of cardiopulmonary function. Another challenge what students face is retention issues. As I mentioned earlier, many students struggle to remember theoretical content with visual examples. This is a case among medical students as well. It's quite difficult to remember all the concepts. And the last one is language barriers. For non-native speakers, scientific terminology can be daunting. Joe comes in here with the visual and interactive resources directly addressing these challenges by offering a multimodal learning approach. So let's now explore the power of visualization. The idea behind Joe is simple. Visualizing concepts through video enhances understanding compared to reading alone. And it's in fact scientifically proven that visual stimulation leads to better understanding. Let's imagine trying to understand how breath sounds correlate with physiological states without hearing them. Or let's try to visualize airflow obstruction in chronic pulmonary disease with just a textbook diagram. At Joe, we bring these concepts to life with videos demonstrating, number one, real-time auscultation techniques, simulated airflow dynamics in healthy versus disease states, and hands-on demonstration of diagnostic tools like echocardiography. So these resources ensure students can visualize, hear, and understand complex dynamics effectively. So here we are today. Joe has 18,000 plus videos in our growing library. I like to call it growing because we have 500 plus videos published every year. With over 1,000 subscribers and over 1 million users, all our videos are available in 14 different languages, making it easier for our global audience. All of these can also be accessed 24/7. We also have videos in 10 plus languages. So we have subtitles in 10 plus languages. And of course, all our protocols are downloadable. Now let me walk you through some of the key things, how Joe supports teaching and learning. So as I mentioned earlier, the first thing we noticed is how we can break down the complex concepts. So our videos break down auscultation and related processes like airflow mechanics into manageable steps. And the second focus is on comprehension and retention. So we combine visuals, experiments, and storytelling. We help students move beyond memorization. So mostly with medical students, it's hard to memorize. So we go with this approach. It leads to deeper comprehension and better retention, empowering them to apply these ideas in their academic and clinical settings. We also have formative assessments in the form of pre-made quizzes for each videos. And you can also customize your quizzes with videos which you select. And you can use them to check your students' understanding or as a discussion starters in class. Our content is very appealing to different learning styles. So with a mix of visuals and narrations, our videos cater to both visual and auditory learners to ensure they grasp the material. And the most important point, I think everyone would agree with this, you'll save a lot of time. So Joe, ready to use resources, let you spend less time searching for supplementary materials and you can focus more on your teaching. So that's a very handy thing to have. And the last is it can we can integrate our content into any learning management systems like Blackboard, Moodle, or even Canvas. Now let me walk you through our website. So you can simply type www.joe.com and uh, let me take you there. Yeah, as you log in, you'll find all these drop-down menus here. The two main sections here are research and education. So under research, we have various subjects and example, if you go to our medicine section here, you'll find video articles with methods published here. So you have various conditions and treatments and studies conducted as well. Under education menu, you can find various subjects as well, and we have Joe Core, Science Education, and Lab Manual. So under Core, we have all the basics. So we start with the basics and work our way to the advanced techniques and methods. So let me show you about our core anatomy and physiology. It has 31 chapters. So there are 646 short lessons. So each video is approximately 90 seconds, dealing one concept per video. Our content is curated based on globally recognized books to ensure scientific accuracy. We also have real-time practical applications of core concepts demonstrated in our scientist in action videos. Let me show you a chapter here. Let's go into chapter 23. You can see all these videos under key terms and concepts. And you can also find our scientist in action videos. So these are videos focusing on real-time practical applications. And these are tailored for undergraduate courses or materials designed for all health science students. So let me show you a couple of videos from, say, our core anatomy and physiology. Let's watch this video showing correlation between ECG and cardiac cycle.
The electrical signals recorded on an electrocardiogram, or ECG, occur before the mechanical processes of systole and diastole during the cardiac cycle. The P wave signifies the spread of cardiac action potential from the sinoatrial node to the atrial contractile cells. Approximately 0.1 seconds post the P wave, atrial systole begins, lasting until the PQ interval. About 0.2 seconds after the P wave, the QRS complex shows up, indicating that the cardiac potential has reached the ventricular contractile cells, moving down the septum to the apex, then upwards. The ventricular systole begins after the QRS complex, spanning the entire ST interval. Simultaneously, the atria return to diastole. Next, 0.4 seconds after the P wave, the T wave emerges, signifying ventricular repolarization. Shortly after the T wave, the ventricles begin to relax. By 0.6 seconds, the ventricles are completely relaxed. The next 0.2 seconds mark a brief period where both the atria and ventricles are relaxed. Another P wave appears at 0.8 seconds, initiating atrial contraction and restarting the cycle. The electrical signals recorded on an electrocardiogram, or ECG, occur before the mechanical processes of systole and diastole.
As you can see how visual representation can help understand anatomical structures and physiological processes. So let me show you another video from the same anatomy and physiology collection. So chronic obstructive pulmonary disease.
Chronic obstructive pulmonary disease, or COPD, is defined as a diverse lung condition marked by persistent and progressive respiratory symptoms such as dyspnea, cough, and sputum production, caused by airflow limitations and abnormalities in the airways. COPD may result due to conditions such as bronchitis and emphysema. Emphysema involves the permanent enlargement of the alveoli and destruction of their walls, leading to loss of lung elasticity. These patients typically feel tired as breathing consumes a lot of energy. They may develop a barrel chest and flattened diaphragm as a result of air trapping, impairing ventilation. In chronic bronchitis, inflammation of the bronchial tubes leads to excessive mucus production and fibrosis in the lower respiratory passageways. These patients develop a high risk of frequent pulmonary infections due to mucus buildup. The primary environmental factors that contribute to COPD include smoking tobacco and breathing in harmful particles and gases from air pollution. COPD treatment typically involves inhaled bronchodilators and corticosteroids. Oxygen therapy is recommended for severe dyspnea and hypoxia. Chronic obstructive pulmonary disease.
All right, so that was video which explains clearly again the anatomical structures. Our animations are so clear that it focuses on the minute of details. So let me also play one more video. So this video is from our medical surgical nursing. So under our medical surgical nursing collection, we have, say, obstructive pulmonary diseases, chest injuries, and we also have cardiovascular diagnostic studies and procedures. So let me play a video from here. Let's say, yeah, diagnostic studies.
Echocardiography uses ultrasound waves to capture heart images called echocardiograms. It diagnoses heart failure and valve disorders, and assesses cardiac structures and ventricular wall motion. Before the procedure, the nurse explains the procedure to the patient, and asks them to change into a hospital gown. Next, the patient is instructed to lie supine on the examination table. The cardiac sonographer then applies conductive gel over the patient's chest and places a transducer at the second and fourth intercostal spaces to the left of the sternum. The transducer is then turned clockwise or counterclockwise, while emitting high-frequency sound waves that bounce off heart structures and return to the transducer. The patient may also be asked to turn and lie on their left side, while the cardiac sonographer adjusts the transducer's angle to capture different heart views, such as parasternal and apical views. A computer converts these sound waves into visual images displayed on a monitor. After the procedure, the cardiac sonographer wipes the gel off the patient's skin and monitors for symptoms like chest pain.
All right, so that's a video from the cardiovascular diagnostic study. So we have chapter-wise videos. Again, we have our key terms and concepts, and also the scientists in action videos, which would be very much applicable for any cardiopulmonary related topics. So I'll quickly show you our website again. So under clinical, we have all these collections, say nursing, even science education clinical skills, where we focus a lot on the examinations, nursing skills. And we also have our faculty resource center, this would be a very handy tool. So when you come down here to videos mapped to our textbooks, we have books ready to use. So when I mention ready to use, it has all the chapters from the widely used books, like you have the Guyton's Medical Physiology, and we also have Head and Neck Anatomy, Ganong's Medical Physiology. So all these books are ready. So we have chapter-wise videos mapped, and it's available as video textbooks. So feel free to explore. We also have weekly training sessions on how to integrate these resources, and we also have webinars conducted. All right, so let me stop here and open the floor for questions.
Thank you, Stephen. So I'll read out the first question for today. So it's about, do we have a video on basic anatomy?
Sorry, again, a basic anatomy?
Yeah.
Yes, of course. Yeah, we have videos on basic anatomy. So as I mentioned earlier, under our core anatomy and physiology collection, we have all, say, chapters covering different systems on the core anatomy part. Yes. All right, so
Okay.
there's one more question. As a nurse, I cared for the first DH. Yeah, thank you. Thanks. Yeah, yeah. It's a very popular video on our website, so we get a lot of views for that. Yeah, thanks for your comment.
Yeah. And then we have another question about the pricing details. So the question is about, is there a cost to, be paid for the videos?
Yes, say if you are a subscriber, then you have access to all these resources. As I mentioned, the research section or the education section. But if you're not a subscriber, definitely we'll make a note of that. So that's, yeah, we can share your, say, what's your need based on what you require. Say example, you want all the core clinical, or you want the science education as well, or you also want the advanced videos. Based on that, the price varies. So I'll definitely convey this message to our team, so they'll stay in touch and give you all the details regarding this.
All right. Thank you, Stephen. So the next question is about, can the samples be downloaded into D2L?
The protocols,
I'm not quite clear. I guess it's about the videos that we have. So the question is, can the samples be downloaded into D2L? Yes, videos.
videos. Yes, as I mentioned, if you're talking about the learning management system, it can be integrated and it can be used. The downloading part, I'm still not sure like how, but it gets integrated. So you don't have to completely download all that. But if you're looking for just downloading, I'm still not sure, but I can definitely check and get back to you. So far, we do it in such a way that the videos are not downloaded, but integrated directly to the learning management system so that it can be accessed. Hope I answered your question.
Yes, Stevens. To add into that, so much about this is also documented on the Faculty Resource Center
Yeah,
about the
absolutely.
integration. Yeah.
Yeah, let me show that details here. So if you go to our Faculty Resource Center, you'll find resources. Yeah, you can see integration of Joe videos into online courses and your LMS. So you have all this, how to integrate Joe videos into Google Classroom, Canvas, Moodle. So all these procedures are here. And also you can book an appointment so that they can walk you through the whole procedure.
Yeah. And Stephen, so the next question is about the customization of the content. So the question reads as, can job content be customized to address specific challenges faced by students in advanced courses?
Yes, Joe platform always allows educators to curate customized video playlists aligning to your syllabus or your course objectives. So this helps students to find what they really need, and also it can be supplemented with additional, so it can pair with your supplementary material. So of course you can customize the playlist based on your objectives or your whole syllabus.
All right. Um, and then we have the last question for today, I suppose. Are there plans to expand Job's library to include recent findings or advanced level content for graduate courses?
Yes, Joe is dedicated to continuously uh, enhancing its content offering. So as I mentioned earlier, there are over 1,200 videos, and we try to add 500 every year. I think the number is more now, and so the ongoing expansion is focused on edge research, all the recent scientific discoveries and advanced experimental procedures, and also on advanced level content. As you can see on our scientists in action videos, you'll find all the advanced level content. And of course, we are expanding in different diverse disciplines, focusing on, say, medical science, public health, engineering, science. So yeah, diverse disciplines.
All right, Stephen. So that's all the questions that we've had for today.
All right. Yeah, thank you again. So thank you for joining today's session. We hope you gained valuable insights into teaching cardiopulmonary dynamics more effectively. For more information or to request trial access, visit our website. Our reps will guide you how to get a trial so you can explore our website. You can see what content we have and how it can be beneficial. So please feel free to contact us directly. Yeah, so have a great day.
Thank you.